Hair loss treatments and support for men and women. Here's the deal. Pattern hair loss impacts nearly 80 million Americans, and we know it can really take a toll on your confidence and your self-esteem if you're starting to lose your hair or if it's getting thin. But there are several effective ways to promote hair growth and prevent loss. So let's dig in. Dr. Michelle Henry is a clinical instructor of dermatology at Weill Cornell Medical College. Dr. Henry, good morning to you.
Thank you. Good morning.
I was just telling you, look, I'm 44. There are people my age, people all the way up. I mean, people, starts to get a little thin for men and women. What are the, I guess, maybe major causes, or is there one major cause?
Yes. So the major cause is androgenetic alopecia, or as you said, pattern hair loss. It affects 50 million men and 30 million women.
What is that?
So it's asymptomatic, but it looks different in men and women. In men, it's that classic receding hairline, thinning at the crown of the scalp. Men can almost become completely bald. In women, it's more subtle. We notice that widening of the part, but equally distressing.
All right, so let's dig into some solutions here. Let's start with topical treatments. What are some of the major ones out there?
Yes, so the first is Rogaine. So this is the only FDA-approved topical treatment to stimulate hair growth.
Okay.
And so there's a 2.5% for women, the 5% for men. It is an exercise in patients. You apply it twice a day. Early results at 3 months, and then average results at 6 months. Some of my patients don't want minoxidil. Sometimes it works too well. You get a little excess hair.
What do you mean too well? Oh, you get hair in places you don't want?
Yeah, you get a little excess hair. So these are non-minoxidil containing products. So we have Retress. All natural botanicals helps to stimulate hair.
Do you just, let's say you're balding in the middle, do you just put it applied in that one spot?
It's a nice serum. You put it on the affected areas.
Okay.
Then there's Lambda Pill. So this is a product by a company called Isden. It has something called Procapil in it. So this helps you reduce that aging process, so reduce premature hair loss. And then there's Kitsuji, which has an ingredient called Redensil. And Redensil has been shown to give results similar to minoxidil without the irritation, without the excess.
Here's a question. Once you start using any of these, do you have to constantly use it for the rest of your life?
You do, because this sort of hair loss is genetic, so you can't change your parents.
So then you just have to do this forever and ever.
It becomes your maintenance.
Okay, what about supplements?
So supplements, this is a controversial category. So I always say supplements are not a treatment for hair loss. They're not going to cure your hair loss, but they create an environment that is supportive for hair growth. Now, supplement market is the wild, wild west. It is not regulated in any way, but these are three that dermatologists are more likely to recommend. So there's Nutrafol, which comes in a version for men and women and for postmenopausal women. There's Lambda Pill, and then there's Viviscal, which you can get easily at CVS. These run in range from about $50 to $80.
So if you're starting to lose your hair, is this enough, or would you still have to probably supplement with something, on the actual spot?
Supplements are a supplement. So you need it in addition to something else.
Let's talk about some conditioners, shampoos. Do these really work?
Exactly. So now we have some hair. We want to retain that hair.
Retain it.
So we don't want breakage. So this shampoo by Dove, it's the Dove Glow and Restore. It's sulfate-free, so it's not going to dry the hair, but it also has ceramides and peptides to strengthen the hair. Now, this one by Camille Rose, it's their Algae Renew Mask. So I love this for those with curly hair. So curly hair is drier, more prone to breakage. So this has a little bit of coconut oil, has some mango butter. It also has some blue algae, which will help to make the hair more resilient.
And is this the same way where it just helps supplement it? I mean, it's not going to be a quick fix.
Exactly. We need all the things for hair loss. We need many products.
2 minutes left. We're on time. What about this?
So these are red light devices. So red light helps to stimulate hair growth. And so this area of using visible light for biology is really popular in medicine. If we can turn this one in here, you'll see the red light.
So if you have some balding, let's say at the top of your head, you put this on, what's it going to do?
So that red light is going to help to increase the density of the hair and to increase the caliber, the thickness of the hair. So this one is quite discreet. You use it 6 minutes a day. This one, I think it still looks really cool, but 20 minutes, 3 days a week. So every other day. Not bad.
Not bad. Okay, is this the last one?
So this is the last one. This is the big gun. If you continue to have hair loss, this is the Alma Ted. And this is our beautiful patient, Katie, here.
So this is, you'd have to go somewhere, right? It's probably a pricier treatment.
Exactly. This is something we use in office. It is brand new technology, just came out in January. So a lot of my patients, when they need to use the big guns, they don't want pain. And so what I love about this is it's pain-free. So this is our beautiful patient, Katie.
Do we have to hurry?
She has a little bit of thinning on the scalp from pregnancy. And so what we do is we apply a growth factor-rich serum, and we're just using this to increase the penetration. How does that feel?
Does it hurt? And we only have about 30 seconds left, but Dr. Henry, how often would you have to do this?
So we want to do this monthly for about 3 treatments.
And
we're seeing really great results after 3 treatments.
That's not bad.
Not bad.
I guess if it works.
And your hair.
That's good. Dr. Henry, thank you. So here's the thing. We have more items and all of these things about hair loss treatments. We put it all on our website at today.com/shop. Thank you.